Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. I have my daughter, Kelli Rogers, here today with me. She's my chief esthetician. You've been with me since you graduated from UT. Yes. How many years have you been with me?
Since I graduated recently, I'm kidding, a long time, over like 10 years.
At least 10
At
years.
least
Come
10.
on. It's been 15.
15 years.
It's probably been
like
15 years.
15.
Anyway, Kelli, you're an amazing esthetician as well as an amazing daughter.
Thank you.
And I just want to wish you a Happy New Year.
Thank you. I appreciate that. Happy New Year to you too.
The reason I'm saying that is because in the winter, your specialty is skincare. You have all these unbelievable machines, lasers, all therapy, skin waves. You have a lot of great equipment here. But really, with aesthetics, you have an eye for beauty and an eye for improving your skin.
I do.
Everybody wants skin. It's the largest organ in the body. I mean, we use medicines through the skin. Skin can age. And being a longevity doctor like I am, you've done a lot of good things with my skin. I get a lot of people saying, at 70 years old, your skin looks pretty good. When notoriously, I think I had really bad skin. I also had very sun-damaged skin through the years of playing tennis and not using sunscreens earlier and all that. I already had several skin cancers taken off, and I'm all the time freezing something off me.
We could write a book on it.
I shouldn't I?
Yeah.
I need to write a book. Every winter, though, I do something on my skin, on my face and my arms and my neck that gets rid of something called actinic keratosis, which is basically sun-damaged skin that can lead to squamous cell cancer of your skin. There's basal cell, there's squamous cell, which is a little worse than basal cell, then there's melanomas, which you don't want. In any event, every winter, this is why we're doing this now in the new year, you should, when you're not getting sun, when you have some time to maybe your skin's going to look a little red, you should refurbish your skin. And every year I do that personally with something called 5FU. Now, beginning last year, I got a combination of 5FU and something called calcipetriene. And a compounding pharmacy mixes this up. It's a prescription medicine. All I do is write the script and guide you with it. But it really gets rid of actinic keratosis, which is sun-damaged skin, and prevents skin cancer from developing. If you have these scratchy lesions on your hands, arms, face that won't go away, that's probably an actinic keratosis. And, of course, we're all well-trained to notice what these things are. So I'd put it on for a month. I would walk around like a walking blister for a month. It was horrible. Now we do a mixture of the 5FU and calcipetriene and do it twice a day for 4 days. And you really don't get the blistering. You're going to be red. You may have a few blisters, but it's not going to be anything like what it used to be like. And it's going to be for a very short duration of period, too, for 4 days. You may be red for another week. You may have some blistering, but it's not anything compared to what it used to be like. It turns out when you add this calcipetriene, which is another it's really a vitamin D analog, it kind of also attacks pre-cancerous skin and calms down the overreaction that the 5FU causes. So you have a double whammy that's much shorter, and it also blisters a lot less. So if anybody is in over 50 range who's gotten a lot of sun, you ought to think about doing this in the winter because it's a good time to do it. You're not out in the sun. You do not want to get out in the sun after you do this. But Kelli, the reason I want you on my podcast today is because you do a lot of other stuff to get rid of sun-damaged skin. You have a line of sunscreens that are not toxic. Tell me what you would do besides this with lasers or products. What's your favorite thing for sun-damaged skin?
Well, and what I can do is prevent you from having to do a bunch of rounds of the 5FU, which a lot of downtime.
Not with the calcipetriene, but yeah,
Right.
it's a different game now. But I know prevention's the key.
Prevention,
What would you
yes.
say?
I would say our CO2 laser right here is amazing. It's called, it's a Deca. Not a Deca, I'm sorry. It's called Tetra, but it has a Deca setting and a CoolPeel setting. So if you are more on the sensitive side and you don't want the downtime of the old school CO2 laser, then you need to do a CoolPeel. So 3 of those is going to equal 1 of a really, really intense old school CO2 laser.
Yeah, those things were horrible. I mean, you have to
Yeah.
almost put to sleep to tolerate one.
Right.
You did a
Pussing,
cool peel on
oozing.
me, and I didn't even feel it.
Yeah.
But I got the results. I mean, my skin got really tight and actually peeled a lot, the next week. But it's very tall. I didn't really hardly feel it when you did it.
Yeah, that's the beauty of it. It's practically painless. We've got a lot of good post-procedure creams too, like I gave you, that has a numbing agent to it as well. But you're looking at just a couple days of being red. If it's your face, you're going to be red for a couple days. And then if it's your, neck, arms, legs, it takes a little longer to recover. But the best time to do it is winter, when you're not out in the sun, when you don't want to be around heat when you're doing this. So it is a great thing to do in the winter for sun damaged skin, also to tighten and for those fine lines and wrinkles as well.
You did my hands and arms. I really have more sun damage on my hands and arms than I do my face. And it really was remarkable in
they look
how much I peeled. It was painless, but I peeled for the next week or two, and amazing before and after on getting rid of these spots on my hands, my aged-looking hands. What else would you recommend this winter to kind of prepare for, when you want to get out in the spring and summer and hopefully use a good non-toxic sunscreen, which we have?
Yes.
Some of them aren't too good for you, and again, I don't mind a tan, but I don't want sunburn.
So the types of sunscreens that we have also protect against heat. So heat can, if you have melasma, can bring that out. So our sunscreens, along with the vitamin C that we have, will protect your skin from producing more melanin or having that come back out. Because that's the tricky part about age spots, sunspots, is they do come back. But if you use the right products, you can suppress that melanin, which is really nice. But yeah, we've got products for that. I would say any kind of chemical peel. We have a triple bright peel that is amazing. And now, like, the technology has changed. You're not going to have the downtime like you would have about 5 years ago. So that's the beauty of everything that we have up here.
Talking about rosacea, it reminded me, I had a patient last week that had requested, and I actually put them on it. It was ivermectin cream for their rosacea. It actually helps it tremendously. It's actually a prescription medicine that's marketed under the brand name. I forget what it is, but it worked. And not a lot of stuff is very effective for rosacea.
Yeah, we've got products for that too, and chemical peels for that. We've got a great mandelic acid peel for, I think I've done that on you maybe a couple years ago, but it's for redness-prone skin, rosacea, and it helps restrict those blood vessels.
I think as you get older, your skin becomes thinner and much more sensitive. I know that's the case for me. You've even done some of these things where you use your laser and get rid of these little spider veins on your face and nose. Those are common, aren't they?
Yes, and that's also a great thing to do in the winter. You don't want to do that in the summer when you're out in the heat, being really active. You're going to want to, if we're doing it on your legs, we'll have to wrap those. But the tiny veins in your face, it is amazing for.
Poof, they're gone.
Yes.
Right? And sometimes that can be, people will notice that before they notice anything. Is a big or small vein on your nose. It looks horrible, and it's just zap it in 2 seconds. But there's a lot of cool stuff you do. I wouldn't know if you have a favorite or not, but
I would say that the CoolPeel is my favorite. It's amazing. It does not have the downtime that a CO2 laser used to have. Also, if you're thinking about, this is off topic, but body contouring, it's a great time to start. Summer bodies are made in the winter. So that's another great thing, the physique.
You're talking about the fat burners.
Yes.
You know how you really cannot spot reduce fat, and everybody worries about it around their middle, maybe on their back a little bit. But we have 2, and they work. One's laser and one's ultrasound.
With the radio frequency.
Okay, so they're painless and they really are effective. How many treatments do you need of something like that?
I'd say 6.
You do a combination of both?
Yes.
Okay.
I like the Evolve machine for muscle stimulation. If you're just looking to get more defined abs, or you want to work on your back muscles, it's great for that too. Your glutes. The Physique is great for burning fat. It's permanent. If you gain weight back, I mean, you're going to get, yeah, exactly. So it's great.
In these days of the great weight loss tools we have, like the GLPs, a lot of times you can't reduce that midsection, and you look great otherwise, but you just can't get rid of that little belly fat. It's a great tool for that, because otherwise, short of liposuction, you're not going to get rid of it really. So I think that is another good tool. So this winter, think about refurbishing your skin, and think about that compounded medicine we use with 5-FU and calcipetriene. You can see any of the providers, or see Kelli. If she thinks you need it, then we'll just send you a script in, and we'll monitor it for you. But in any event, very few contraindications to that at all, really. But we keep an eye on things. We know what we're doing. Kelli's certainly a maestro with beauty and skin. So please come see us at Performance Medicine.
Yes.
And Happy New Year.
Yes. Happy New Year.